But when you use resistance bands or you're using dumbbells or medicine balls, then you can strengthen your muscles in the directions that is most comfortable for your body and for your joints.
I also think remembering, if doing things on land, I would say in your everyday is too much, getting into a pool, which will help unload your joints and allow you to
Mhm.
move more freely while providing resistance. And then you can add different tools into the water to give you more resistance. Sometimes is a great way to kickstart you into exercise because you don't become discouraged from it. And I
Mhm.
think I think April, you said it is not underdosing or overdosing, is kind of figuring out what is your right amount of time to build up, understanding what your goals are. And then I think to Lauren's point is you have to respect how much you can do to start, and then understanding your rest and recovery in order to do
Mhm.
it. And along with that is understanding the difference between pain and muscle soreness versus joint
Mhm.
pain. So if
Right.
you're sore in your muscles, that's a good thing. But like Lauren said, you shouldn't have this soreness lasting days afterwards. It should be a
Mhm.
delayed onset of soreness, but
Right.
it resolves on its own.
Getting started, I think, is the hardest part. It's
Mhm.
the hardest part for anyone to get started into an exercise routine. Our bodies are actually made to conserve energy, right? So just
Mhm.
through time, our bodies are made to conserve energy as a safety mechanism in case we go through a famine. And so getting started exercising is hard for anyone.
Mhm.
When you're in pain, it's even harder
It's even
to get
harder. Yeah.
started, right? So I really think that the first thing is just knowing that anything is better than nothing.
Mhm.
And a couple of squats, as Jessica and I were both talking about squats and using a chair, and just sitting down and standing back up, and sitting down and standing back up, and you're exercising.
Mhm.
And that's safe. You're in your home. You're in an environment that's comfortable for you. It feels emotionally comfortable for you, and I think that emotional safety is a big part of it when you're starting an exercise program for the very first time.
One thing that people with arthritis can always do um, is if they are, they're having their arthritis, they can always speak with their family doctor
Mhm.
about possibly getting a PT or an OT referral, depending on where their arthritis is. So you would have an OT referral if they had any arthritis to their hands, elbows, shoulders, PT referral for everywhere else in the body. And you could start there. And
Mhm.
if you have insurance benefits where you could go in and somebody could help you get you started with exercise
Mhm.
because we're trained to do that. And if you don't feel comfortable going into a hospital or clinic setting, there's always telehealth options now with the pandemic. If your insurance, you could always call your insurance and see if you have those benefits. So you don't even have to go into a clinic. You can have the evaluation over the phone through um, like through the portal through the physical therapy or whatnot. And I did that
Mhm.
a lot actually during and still through after the pandemic or as we're going through the pandemic for people who still don't feel comfortable. It's a really nice option for people just to get them started where they feel like, okay, they can have one or two sessions with the PT or the OT, and then they can come back and check in as they're going through their progressions. And we can be of assistance. That's just rather than getting a personal trainer, that's just one way to get started, and then they can go off to the gym and use those
Mhm.
techniques um, as they see fit. And I can get into modifications in a little bit. But using the Arthritis Foundation is some place where I always tell my patients to go because the tips
Mhm.
and tricks for arthritis is so fantastic.
Yeah.
Um, and it's one of my on my evaluation with these patients, it's one of the first places I take them to. Is like this is a great resource for you to go and look at diet, nutrition, look at
Mhm.
joint protection techniques.